In this segment of Health Beat, we will be discussing breast cancer in the news with Medicine Net's Chief Medical Editor, Dr. William Scheel. Dr. Scheel, it was recently reported in Reuters Health News that 36-year-old Australian pop star Kylie Minogue was diagnosed with breast cancer. Isn't 36 a particularly young age for this type of cancer?
I recently read about that same occurrence of Miss Minogue in the popular literature, in the lay press, and this is a very unfortunate situation. You're right, it is a particularly young age. 94% of breast cancers, according to recent Center for Disease Control statistics, occur in women over the age of 40. So Miss Minogue's breast cancer is strikingly uncommon incidence in that age group.
Does the fact that she's under 40 mean that her breast cancer is different from women over 40?
Well, actually, it may mean it's different or it may be the same. But the fact is that in women that are under 40 years of age, their survival rate is decreased. So it's often associated with a more aggressive form of breast cancer in the younger woman. The other important thing to note is that when a younger woman develops breast cancer, because it may be more aggressive, the doctors will tend to treat it even more aggressively. In fact, it's my understanding that Ms. Minogue has already received surgery for her breast cancer, according to Reuters report, and this would be an example of a more aggressive type of treatment in this young woman.
Dr. Scheel, what are the risk factors for developing breast cancer?
There are a variety of risk factors for developing breast cancer, but particularly those factors that place women in higher risks include a family history. A mother had breast cancer or a grandmother had breast cancer. A woman has had previous breast cancer, that she's had some of the newer breast cancer risk factors are gene markers for breast cancer that can be identified on breast tissue. So if one were to inherit one of these breast cancer genes, and those are referred to as BRCA1 and BRCA2, then that places a woman potentially at higher risks of breast cancer. We also know that being overweight and not exercising and excessive alcohol can increase your risks for breast cancer. And so prevention methods like weight reduction and exercising and minimizing alcohol intake are very important. And of course, the primary prevention method is to regularly do mammograms.
Dr. Scheel, how common is breast cancer compared to other cancers?
Well, actually, breast cancer is second only to skin cancers in frequency in women. So it's extremely important that women have regular mammograms. There's a wealth of breast cancer information in MedicineNet.com's breast cancer article.
Thank you, Dr. Scheel, for being with us on this segment of Health Beat.